On the morning of your angioplasty, after you arrive at the day unit, the doctor will come and discuss your procedure to make sure that you have a good understanding of what will be happening once you come to the cath labs. When coming for a procedure in the cath lab, some patients find it more comfortable to wear their own clothes and walk from the ward to the lab to be checked in with one of our nurses. Once in the cath labs, the nurse will make sure you are familiar with the area, introduce you to the team and go through the checklist with you. Whilst one of the team are completing the checklist with you, the rest of the team will be preparing everything needed for the angiogram. Once we are all happy with the checklist, you will be asked to lie down on the narrow X-ray bed so you are ready for the procedure. The physiologist will attach monitoring to you so they can keep a close eye on you throughout. The nurses may attach a line to your cannula so we can give you medications if needed. The scrub nurse will introduce themselves and then prepare your wrist or groin depending on the access needed to carry out the angiogram. Once the access area is prepared, you will be covered with a sterile drape by the scrub nurse. The doctor will then give a local anaesthetic to numb the area and place a tube called a sheath into the vessel so that he can pass the wires catheters through the vessel into the heart. At all times, the physiologist will be monitoring you. Once the sheath is in the vessel, the procedure will begin and the camera will come over your head. After the angiogram is complete, the doctors will discuss the pictures in the viewing area and decide on any treatment needed. If a vessel is found to be narrowed, the doctors may decide to open the vessel with a balloon and stent treatment called an angioplasty. To put the balloons and stents into the vessel, the doctor will use a wire in the artery like a tram line for the balloons and stents to travel down. This will enable them to place the balloons within the narrowing in the vessel. Once the wire is in position, the doctor will position the balloon in the vessel and inflate it to widen the artery. Once the vessel is wide enough, the doctor will send a stent down the wire to hold the narrowing open. During the procedure, you may have some discomfort, but we will always give medication to prevent this if you become aware of any discomfort. Once the stent has been deployed, the doctor will make sure it is embedded into the vessel wall by using a non-compliant balloon to make sure the stent is well placed. Once the procedure is over, the scrub nurse will place a small pressure band around the wrist to stop the vessel from bleeding. This band will remain in place for approximately 2 hours. The nurse on the ward will remove it once she is happy the puncture site has healed. You will be taken back to the ward on a chair or a trolley depending on the medications given during the angioplasty. Before returning to the ward, you will go into the recovery area whilst the nurse gathers your notes. Later that day, the specialist nurse or registrar will come and show you the results of the procedure and discuss any concerns you may have. Lots of our patients go home the same day or on the day following the angioplasty.